Good afternoon. We are on the record. This begins videotape number 1 in the videotape deposition of Dr. Robert Wilson, MD, in the matter of Jordan Mink versus William Morris Endeavor Agency, LLC, et al., pending before the Superior Court in the County of Los Angeles, State of California. The case number is SC114406. This deposition is taking place at 9033 Wilshire Boulevard in Suite 400 in Beverly Hills, California, on behalf of the plaintiff. Today's date is January 7th, 2013. The time is 2:41 p.m. My name is Lisa Labuddy with Personnel Court Reporting at 14520 Sylvan Street in Van Nuys, California. Would all present please identify themselves, beginning with the witness?
Dr. Robert Wilson.
Rich Galliano, Alder Law, on behalf of the plaintiff, Jordan Mink.
James F.B. Sawyer on behalf of defendant.
Would the court reporter please administer the oath?
Please raise your right hand. Do you solemnly swear that the testimony in the following deposition will be the truth, the whole truth, and the truth, so help you God?
I do.
Okay, good afternoon, Doctor.
Good afternoon.
Let's start with you're being designated here today as an expert. You've been deposed numerous times.
Yes.
Can we just go forward, or
Yes.
we'll forego the admonitions?
Yes.
All right, great. Your file, you've been kind enough to give us a copy of your exam notes. We have your 2 reports. I'd like to attach the file as Exhibit 1, but I'd like to keep my copy. So if possible, would it be okay to give the court reporter a copy of the file after the deposition?
Yes.
Okay. And we'll call that Exhibit 1. Can you tell me when you were first retained in the case?
My office was contacted in October and set up the exam date for initially for November 8th, 2012.
And was that exam then continued to November 19th?
Yes, it was.
Okay. And I only saw that one correspondence. I don't have the date on it, but you're looking at it.
October 11th.
Yeah. Was there any other correspondence to your office that enclosed records for your review?
That's only one I'm aware of.
Okay. So then the records that appear on the left side of the file were those just mailed to you, or how were those conveyed to you?
What says on here, attached, please find the medical records, so I assume it was attached with this cover letter.
Gotcha. Okay, great. And when you were contacted back in October, did you have any conversations with defense counsel regarding what the case was about?
No, I did not.
Okay, do you have, what's your understanding of how this accident occurred?
That Mr. Mink was skateboarding.
Okay.
Was hit by a car, went to the ground, had the various injuries. Paramedics arrived. He was transported.
Okay. And with respect to, just by way of background, have you worked with this defense firm in the past?
Yes.
Okay, so you're aware that this defense firm is Zurich in-house counsel?
That I wasn't.
Okay.
I don't know which insurance company they work with, but I have worked with them.
Okay, fair enough. Ballpark figure as to how often you work with them?
I believe there's 3 or 4 cases that I've met the attorney with before, but I don't know if there aren't other ones that I didn't meet or have a conversation with, or if there's other attorneys too. I wouldn't know that.
Okay. How about Farmers Insurance, Early Maslack, do you work with them?
Yes.
Okay. How about Allstate Insurance, do you work with them?
Yes.
Do you review cases and serve as an expert for California Insurance Group?
I probably have. That name doesn't sound familiar to me, but I wouldn't know.
Okay. How about Progressive?
Probably. Again, I don't necessarily know which insurance companies are involved.
Okay, you deal more with the law firm that is representing the defense.
Correct.
Okay. Um, would you know offhand whether you've worked for Mercury Insurance before?
I'm sure I have.
Okay. How about State Farm?
Yes.
Okay. All right. And so how much have you been paid to date in the case?
I wouldn't know, but they'll be happy to print out the billing for you.
Okay. And what is your billing rate? I know I have your CV here for the when you review records for a defense firm. Is it $4.50 an hour?
No, I don't normally charge per hour. It's around $900 to see a patient, review records to a certain size. If it's more than half an inch or so, then they just charge by the inch.
By the hour?
By the inch.
Oh, by the inch. I'm sorry.
Yes.
Okay. And I see. Base price includes the first inch of records, and then it's $2.50 per inch of records thereafter.
Yes.
Okay. And the evaluation I have here is $975.
Sounds correct.
Okay. And how about the our time here?
$8.50 an hour for anything I have to do hourly wise.
Okay. And with respect to the designation that Mr. Seipler filed, it says that you're going to be testifying regarding the plaintiff's injuries, damages, medical condition, care, and treatment?
Yes.
Okay. And also as to the reasonableness of the medical care that he has received to date, as well as any future medical care that is being claimed?
Yes.
Okay. And with respect to the, and I'm just going to go through the series of questions that we usually ask at depositions regarding the nature of your practice and things like that.
Certainly.
So, how much of your time is med legal?
I don't track by time, but the patients I see, about 20% are here for a medical legal evaluation, such as this one.
Okay. And so when you see patients in the office, how often are you in the office? Are you
Would-
how many patients do you see a week approximately? That's probably not bad.
It can vary. I can see 10, 15 patients on a day. It's usually sometimes 3 days a week I see patients.
Okay, so we're talking about
But-
75, 80 patients a week?
Not usually. It's usually less than that, but that would be a, no, because it's usually, as I said, 10 to 15 a day. It's only 3 days a week, so as a maximum, it'd be 40 a week, but it's usually less.
Okay.
I would assume somewhere around there.
All right, so and tell me what typically occurs in your practice so in a week. So you'll see about 40 patients, and what else will you do?
Surgeries, when that's the
And-
main things I do, patients and surgeries.
Now, my understanding is that your expertise within orthopedics lies with the shoulder and knees.
Of the surgeries I do, majority are knee and shoulder. Of the patients I see, probably half are neck and back, just because that's what's prevalent.
Okay. And in terms of seeing patients, in terms of seeing them for the for an evaluation requested by the defense, that's going to be neck and back.
Can be, or knee or shoulder, ankle or whatever. I mean,
When you say majority of the patients you see involved in neck and back,
meaning more than 50%, meaning just half the patients I see are neck and back, just because that.
gotcha. Okay.
20, 30% are knee and shoulder, and others are ankle and hip. Of the surgeries I do, the majority are knee and shoulder. I did a fellowship training in that, so I still do a lot of those types of surgeries.
Okay, and that was so. Then post-residency, you did a fellowship in knee and shoulder.
I did 2 fellowships, one in trauma and one in sports medicine, mostly knee and shoulder and ankle, but
Okay. All right. And how many, approximately, what range of exams do you do requested by the defense or workers' compensation?
you mean number-wise?
Yeah.
Well, we already covered that, about 20% already said,
Let me ask it this way, just approximately how many physical exams do you do relating to to med legal? Just the numbers, like
It could be from
5?
2 to 5 on a
Okay,
day, I mean, but not every day, so I mean,
okay.
but somewhere, yeah, 6 to 10 a week, I guess, I don't know, something like that. Could be for med legal, other weeks not at all. But
Okay, so then if you were going to do 2 to 5 a day, would that mean approximately, yeah, that's right, because you're here 3 days a week. So what about the other 2 days? Is that when you're doing surgeries?
was one day I do clinics, sometimes, especially work comp ones, off-site here. I do surgeries, yes.
Okay. And when you say clinics, can you explain what you mean by that?
Work comp treating ones. I work with a couple different groups that now we're treating patients. So I see them in different, not in this location. One of them's down on Wilshire, another one we're setting up in Lancaster, there's one in San Pedro.
Okay, and so are those facilities designed to evaluate workers' compensation applicants and treat them?
Yes.
Okay, and so then and that's going to be in Lancaster?
There's one in Lancaster we're setting up there. There's one in San Pedro currently, and there's one down on Wilshire.
Okay. And who retains you for those services?
Different entities. In other words, basically it's people in that location that have work comp injuries, and so the various attorneys send them to me to be treated.
Okay. Are they attorneys representing the employer? Are they defending the workers' compensation case, or do they represent the applicant?
More the applicant, but I mean, we'll see any of them, but yes, I mean, probably the majority are the applicant.
Okay. And so that would be 1 day a week?
It varies, but yes, one day, sometimes more than one day.
All right. And so that would give you a free day. Do you take that day off, or do you work?
Whenever I can.
Okay. All right. And when you don't, what are you doing?
Catching up on dictations or doing an extra surgery or seeing a patient if I have to or whatever.
Okay.
I usually don't schedule things on Fridays unless I have to.
Got it. Okay. And now, I know that as an expert, you testify in trial
Yes.
fairly regularly.
Once or twice a month, yes.
Okay. And, well, I have read a transcript that suggests that maybe sometimes it's even more than twice a month. Would that?
Sure, some months it's a lot more, other months less.
Right.
I think it was once in December. So it's probably been once in the last month. And
Right.
But yes, some months, sometimes it all piles up. You do a whole bunch in a week and then nothing for a month and a half.
Right.
It's not regular. It doesn't, there's not a consistency to it.
Sure, and I realize, I can appreciate that there's a variation, but sometimes it could be 3 or 4 times in a week, right?
Could be, yeah. It's very rare, but yes, that's happened.
Okay. And generally, those were all for the defense, that trial testimony?
Majority, about 80% of the patients I see in the med legal are for the defense, and so majority are.
Well, the reason why I'm asking is because I'm trying to get a handle on, I know that the overall nature of the patients you see is 80-20 defense. I'm interested in how much of that, when it goes to trial, are you testifying as a defense witness versus a plaintiff? And if you don't track it, that's okay, but...
I don't track it, but the last case I did was for the plaintiff. The last trial, the only one I think I did in December was plaintiff. And I mean, there's been at least 2 or 3 in the last 6 months that were plaintiff. So
Okay. Who's the plaintiff lawyer in that case?
Rob Weiner
Okay. And
was one of them. The other one was Shagarian was another one. Morris was the other one. So I mean, there's been a few.
can you count them on one hand, though, these plaintiffs' cases?
As far as testifying in trial in the
Yeah.
last few months,
How
yeah,
about-
there's probably been only 3 or 4 in the last 6 months. Yes, but as far as patients I see, no. There's
Okay, all right. Okay. So let's talk a little bit of just about income. And obviously this is not to put you on the spot or anything, but I have to get a sense for how much you make with the med legal work.
Yes,
All right. Fair question?
certainly.
All right. Can you tell me approximately how much you made last year?
Well, first, I don't track by income. Based on the number of patients I see and how much it is, looking at it, it's approximately 400,000 a year, I would assume, but I don't track the exact number.
Okay. Now, you know Dr. Clapper's got you beat on that one. You know that.
Probably, he's a busy guy.
Okay, all right. All right, and so out of the 400 is 80% of that defense versus 20% plaintiffs?
I would assume.
All right, okay. And let's talk then a little bit about the reports. The notes, the chart, I take it was the examination notes from the evaluation that you performed on November 19th, 2012?
Yes.
Okay. I've got your typewritten reports. Probably going to need a little bit of help with this. So why don't we start with this?
Certainly.
Can you tell me what we see in the handwritten portion on page 1 of the report?
Well, the initial history is taken by my historian, so the legible handwriting would be that from my historian.
Okay. All right.
The writing more to the right would be mine, where I review the history with the patient and make my notations or additions.
Okay, and so let's then, essentially, the examination consists of your assistant taking a history and then you performing a physical exam, right?
Reviewing the history and performing a physical, yes.
Okay, and do you ask the plaintiff any questions or the patient any questions while you're
Yes.
conducting the exam? What types of things do you ask the patient when you're examining him or her?
Well, it's reviewing the history, as you can see by my various notes there, so all the writing in mine thing would be questions I ask the patient.
Okay, and then so how long does a typical orthopedic examination take?
Well, it can vary, but probably around 20 minutes to review the history and examine someone.
Okay. And is there any way of knowing how long this one took, or can we just estimate it's somewhere between 15, 20 minutes, 15, 25, whatever?
I don't see any reason why this one would take excessively longer. Usually when they're longer, it's because someone's a very bad historian, or they don't, if they don't speak English, obviously, or if it's a very complicated one, or if they have more than one history of injury. I mean, there's some ones that take much longer.
Okay.
Some take an hour, but there'd be no reason I would see that this would take an excessive amount of time. It's pretty straightforward.
Okay. And do you have any independent recollection of seeing Jordan?
I do. It hasn't been that long, so yes, I remember
Okay.
seeing him, but I would defer to my notes for anything.
All right. Would you agree that he was truthful?
Well, I never make a representation that I can tell if someone's being truthful, but he gave a history. It seemed to match the medical records. Would never make any statement that he wasn't truthful.
Okay. Well, if someone was malingering, you would note that, or if you had a suspicion someone was malingering. Right?
I don't use that word malingering. I mean, if there are people who have like symptom magnification, there's other things, but malingering implies that you know that someone is intentionally trying to deceive you, and I don't know that any of us know that, so I don't make representation to that.
Okay.
I don't
Well,
use that in my thing where I've never called anybody a malinger. I don't like that term.
Well, let's use your terminology then. Do you have any reason to believe that he was exaggerating his symptoms?
Again, I wouldn't have any way of, I wouldn't be stating that. Everyone can state what hurts or how they feel about it. But I mean, obviously what one person describes as pain on an 8, other people would say a 6, and there's various differences. I wouldn't be able to tell what it is, but I won't be making any statements that I know that he is being dishonest, because I wouldn't. I accept what he says. If he says something bothers him, that's what he states.
Okay. Can you tell me what your notes say in the portion of the report, page 1, above the section that starts current complaints?
Well, it starts out, to the left, be the first one. It says number 1, it says ankle, daily, lateral, meaning the lateral aspect, increases with activities, standing, especially prolonged sitting and then standing, that it clicks, that if he walks a long distance, more than half a mile, then he can get some pain. It says regular shoes, meaning he wears regular shoes. Above that it says the neck, because then it talked about his neck a bit. His neck aches, midline area, no radiation.
Okay.
Below there it says left arm, loss of sensation, dorsum from the elbow to the wrist, finger, meaning finger sensation is normal. Then it talks about the left forearm and elbow, and again, we have the history from the historian also, but I'm just reading my notes, which were the additions to what had already been taken by the historian. I would say regarding the left forearm between and below down is left between first and second. He gets some decreased sensation, and it talks about occasionally pain in the left elbow if he rests on it, especially on a, I guess that's on a surface table, something. Random forearm pain sometimes. And no other complaints.
Okay. So he is documenting, the report does document a loss of sensation in the forearm area and some pain in the left elbow?
Correct, and a little bit about the first and second toes and a little bit into the neck.
Does it say whether it's the right or left? Is it the left foot that he's
Yes.
got? Okay.
As well as the left ankle.
Right. Okay. And he also has pain, right, as well as pain in the left ankle.
Correct.
Right. Okay. And did you hear a click when you examined him?
No, he said he clicked or felt it click, I think, but no, I wasn't able to have an auditory
Okay.
finding.
Next, we've got the history of the illness, and then the treatment history. And from reading your report, my understanding is that up as far as the treatment, the past medical treatment that he received, that you deem that to be reasonable and appropriate.
Yes, per the medical records I reviewed, his treatment was reasonable and appropriate and directly due to the injury.
Okay. And can I get, just so I know what records you reviewed, can you just list them so that we can get those in the record?
Yeah, what's under your I have, it's already listed in your review of records section, you already have that.
I see what you mean. Okay. So then I'll just read them off and we'll read them together. How about that?
Fine.
I've got the Los Angeles Fire Department report, Ronald Reagan, UCLA, Emergency Services, Dr. Sergei Chetarov, Sergeiterterov, Alan Zhang, Mary Richards, all of the x-rays and studies done at the UCLA Medical Center, Dr. Abraham Kim at the UCLA Medical Center, Doctors Nelson Suhu and Frank Petrigliano at the UCLA Medical Center, Colby Home Health Care, and Dr. Jessica Wall at the UCLA Medical Center, as well as Vert Sports Therapy.
Correct.
Okay. And, oh, can you tell me what the fees are for, this is going back to what your fees are for the trial testimony. What do you charge?
It's based on the $8.50 an hour, depending on how many hours I'd have to be out of the office.
Okay, so that's portal to portal in?
Yes.
Okay. You don't do the half-day deal or the full day, that kind of thing? It's more an hourly?
It works out the same thing, yes.
Okay, all right. And can you give me a ballpark of how many hours? I should have covered this earlier. How many hours have you into the file so far?
Well, as we talked about, I don't track by hour, so I wouldn't know because I charge just flat rates. I'm not very good at telling them how many hours, but it takes 2 to 3 hours sometimes to review all the records, prepare reports, as well as the exam. So I don't track by an hourly.
Fair enough. And the records there are about less than an inch?
These are, yes. Now, there may be some that were sent back. Doesn't mean that this was all the records, because it looks like there's a lot of records that I probably reviewed that didn't have anything to do with this injury. Those would all be sent back. So
Okay.
this doesn't mean it's all the records I reviewed. This is be the ones that I've kept because
They
probably
really,
relate more to the injury, or it's just easier to keep some, but
okay.
there's other ones that I assume were sent back.
Oh, it looks like there were some records from June 8th that had to do with the shoulder,
Correct.
the right shoulder, and those you don't have.
Correct.
The radiographs that appear on page 5 of your report, however, those are all related to this report, correct?
I reviewed a number of radiographs as noted, yes.
Okay. Did you actually review the films, or did you review the reports?
I saw films on a CD.
Okay, great. And let's see. Do you can you tell me the last time you performed an elbow surgery of any kind?
2-3 weeks ago,
And what was the nature of it?
biceps tendon rupture.
Okay. And have you ever cleaned out scar tissue or performed any kind of radial nerve decompression?
Both, yes.
Okay. Alrighty. And do you think that that would be a reasonable surgery for Jordan to undergo in the future, given his complaints of lack of sensation and pain in the elbow and forearm area?
No.
Okay, why not?
His complaints aren't of an ulnar distribution. His complaints are consistent with the degloving injury. Decompressing the ulnar nerve is not going to help with that.
Okay. And do you think that any surgery of the left ankle is indicated to address his complaints of ankle pain?
No.
And why not?
Again, he doesn't have findings of any significant instability. It's not like he has a pathological laxity to the ankle. He doesn't have any findings which suggest that he would benefit from surgery. I wouldn't recommend surgery.
In fact, you are of the opinion that no future medical treatment is indicated, correct?
Everyone benefits from some rehab exercises when you have injuries. I'm a big advocate of people doing a rehab exercise strengthening programs, even if you haven't had injuries, but especially when you've had some injuries.
Would you be giving any opinions on the appropriateness of any kind of scar revision surgeries or removal of the debris that appears embedded in his left arm?
No.
And would you agree that all of his residual symptomology correlates and was caused by his him being in an accident involving a motor vehicle back in June 19th of 2011?
Well, again, you can't say things for certainty. I mean, he relates he gets some pain into his neck, which come and go. Studies show the vast majority of the population will have pain into their neck. After you've had an accident, you may be relating it more, so it's not uncommon then when people get pain to relate it to something memorable like an accident, but it'd be really hard to try to say that it's definitely that now that if he has a little neck pain that somehow that's related, but I understand how patients may relate it, but I don't think that would necessarily be reasonable. And again, when you have the skin injuries about the forearm and the elbow and loss of sensation, I think he is going to have symptoms there. He has good range of motion, no instability. It's not like it's affected the joint, but to the extent that the loss of sensation bothers him or the scar bothers him, that's more of a psychological thing, but that is whatever it is. Again, I've seen an awful lot of ankle fractures. This is a very small avulsion injury. It'd be rare to have any significant pain, but someone says it aches sometimes after prolonged activities. I guess so be it.
Was it more than one ankle fracture though?
No, it's just the avulsion of the malleolus, where he pulled a small piece of bone, not the entire malleolus off or anything, but a small piece got pulled off. That's when a ligament pulls off the bone. A small piece of bone came with it.
I've got, okay, so if you take a look at the page 3 of the record review, this would be 1, 2, 3 entries down. It shows an anterior medial distal tibia fracture, right?
That's the avulsion one, yeah. That's the piece of bone that pulled off the tibia, which is the medial malleolus, is the portion of the tibia that got pulled off, yes.
Okay, so the distal, that's the outside, right?
That's the distal, the far side. The proximal is the close side, meaning far away, meaning down in your ankle, not, the tibia runs from your knee to your ankle.
Oh, I got you.
By saying
Okay.
distal, it means the ankle portion of the bone.
Got it. So then when we're looking at Abraham Kim's entry, and it talks about the displaced anterior tibia avulsion fracture, that's the same fracture.
Yes.
All right, what about the left Lisfranc fracture? What's that?
That's different. I saw that a doctor says that, but I've never seen an x-ray that showed that, nor did I see any radiologists confirm that. So I was never sure whether that meant that somebody saw it or they were worried about that.
Okay. So you haven't seen the x-ray, but this doctor who's taking a look at the...
Well, I've seen a number of x-rays, but if there is an x-ray that shows that there was a Lisfranc's, it wasn't in the other films I saw.
Okay.
I guess it's possible to have such a small fracture you can see it on one but not the other, but that's pretty rare. And all I can tell you is I didn't see it, any other doctors noticing it later, and I did not see it in the actual films.
Okay. Then let's jump down to the last entry on the page, June 23rd, 2011, and it talks about an avulsion fracture of the medial malleus.
That's the same as the tibia one, yes.
Okay, so those are just
Different ways
somewhat
of
different
describing
nomenclature of describing the same
same
fracture.
thing of, yeah.
Gotcha, okay. And all right, and so do these two reports then contain, as well as your testimony here today, contain the opinions that you intend to give at trial today?
Basically, yes.
Okay.
Of course, people could ask other questions beyond what I've given, but yes.
Okay, but as you sit here today, based on what you know about the case, all the opinions you intend to give have been provided in the reports and in your testimony here today?
To the extent that he had the specific injuries, the injuries are detailed, per the medical records, that his care and treatment would be reasonable and appropriate, that at this point he has, he relates the various symptoms, but we already talked about that there could be reasons for people to have symptoms, and that I think a rehab exercise program is very useful, but I certainly wouldn't recommend any surgery or other specific orthopedic intervention that I would anticipate at this point, and that pretty much it is what it is.
Okay. Well, are you talking about the symptoms that you were talking about, the foot, the ankle symptoms, and the left ankle and the left elbow? You're not suggesting that any of those conditions were pre-existing, are you?
No, I'm not aware of anything
Okay.
of him having prior complaints in any of those areas.
Okay. So then it's really more the neck and back, and I know, I've been in depositions with you before where you talk about how degenerative processes start at a very young age, and and there's some literature on it as well.
And some people, yes.
And, okay. but
Meaning
you-
there can be reasons why people have complaints of pain, so what we look at is to say what would be reasonable from an accident like this, and just because someone had an accident and they have complaints later doesn't mean that it was caused by that, but I already told you, I think definitely some of his complaints would be, you know, the loss of sensation, the gloving injury, whatever, you know, the scar, that
Hang
is
on.
what it is.
No, let's talk about the neck and the back. Have you, when you looked at the X-rays for his right shoulder, did you have any reason to believe that he injured his neck or his shoulder prior to his accident in our case, which occurred on June 19, 2011?
I'm not aware of any, no.
Okay. Are you aware of any reason why he might have had a symptomatic degenerative condition in his neck or back prior to our accident? Symptomatic meaning he was experiencing pain prior to our accident?
I have no records before, so I couldn't tell you whether he had symptoms, but I'm not aware of any.
Okay, fair enough. And have you reviewed any documents, any records in this case subsequent to the November 19th, 2012 report?
No, I think that's the last records I saw.
Okay. With respect to my esteemed colleague who is here for the defense, can you tell me a little bit about your conversation with him prior to the deposition beginning?
Yes, we met briefly before. I reviewed with him physical exam findings. We discussed the accident. I basically told him I thought the care and treatment was reasonable. I thought the injuries were as I noted, and that, again, that it was fairly straightforward.
Okay. And with respect to Jim Seipler, who is going to be the trial attorney in the case, have you discussed the case with him after conducting the medical examination that he hired you to do?
Not that I know of, no.
Okay. Would that be noted in the file?
Yes, generally if I had discussion, I would have noted it.
Okay. And with respect to the, let's talk about the elbow a little bit, the gloving injury. It's my understanding that's when the skin is basically pulled off the area. And do you know whether or not Jordan lost any, was there any damage to the soft tissue around the elbow?
Since skin is soft tissue by definition, yes, but if you mean underlying the skin, it
Yes.
does not appear that there was, per the reports, meaning the muscles, the things below the skin. That's what makes it a degloving injury. It's just the skin that pulls off, not the deeper tissues.
Right.
By definition, otherwise it wouldn't be a degloving injury.
Okay. And with respect to are there any nerves in the skin?
Yes, that's why when you have a degloving injury, usually you will lose sensation to those small nerves. Some of it comes back, but not all of it.
Okay. Do you know whether or not the motor functions in his ulnar nerve were intact when you examined him?
Yes, he had, ulnar nerve was intact when I saw him.
Did you note any scarring, any chest lacerations that left residual scars?
He had some various scars and road rash and things. The main one, of course, was the elbow, but he had other smaller little ones.
And can you tell me, I'm curious why you noted in reviewing the x-rays of the right shoulder that there was no arthritis. This would be on page 3 of the record review, 3rd paragraph down. I'm sorry, 2nd paragraph. There is no arthritis in the right shoulder.
Something, when I generally look at, so many patients I see have arthritic changes to their AC joint already, especially in athletes and things, so something I look at because
Sure. Okay.
later on, years later, they want to know,
Right.
was there a change?
Sure. And so would you note any arthritis if you saw it?
Yes.
Okay. And it's my understanding that there is no arthritis noted in any of the x-rays you reviewed?
Correct.
Okay. How about the well, I guess let me withdraw that. I guess the only real issue within the case is whether or not the future treatment, future surgeries to these two areas, the left elbow and the left ankle, are reasonable and necessary, and caused by the pedestrian versus motor vehicle collision that occurred in the case, right?
Correct.
All right, we have a reasonable difference of opinion on that, right?
To the extent I definitely wouldn't recommend surgery, that's correct.
Okay. Any intention to issue any additional reports or augment your opinions here today?
Not unless someone sends me other records or other x-rays.
Okay. And that's all I have. We're good?
Very good.
Jim? All right, well then let me enter into a stipulation. Doctor, do you prefer to read this, or are you okay with?
Unless you're rushed for trial, I prefer you send it to me, unless if you have a trial coming up in the next week or two or something.
It's about 2 weeks off. We'll send it to you, sure.
If you have time, if it's coming up, if you can just send me a condensed copy, I'll waive signature, but
Okay.
I'll leave that to you depending on your time frame.
Okay. Well, we'll order it expedited, and as soon as I get it, that means counsel's office will get it. I'm happy to send you my copy, but if you'd rather,
We'll handle the communication.
Okay, that's fine. And so we'll, all right, so we'll stipulate that with that indication that the doctor will waive signature, that defense counsel will retain custody of the original, and we'll
As well as the videotape recording.
and the videotape recording, and we'll lodge it with the court and produce it for trial. We would ask that it be produced for trial, and in the event the original is lost or otherwise unavailable, that certified copies of both can be used in its place, and that's really all there is.
So stipulated.
Okay, thanks.
I'll go make a
No,
copy.
relieve my duty.
And we're going to relieve the court reporter of her duty under the code as well.
This concludes today's deposition of Dr.
Did
Robert
you-
Wilson,
I didn't know if
MD.
you, did you,
One videotape
I
is
didn't know if
you
going
marked
off the
them.
record. The
Yeah,
time
that's
is
fine. I
3:24
didn't, but
p.m.
if you want to, you can.